Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh to all of my classmates and my dearest lecturer, Dr. Ahmad Zukan and Ismail. Today, our group, which is a shoulder group, will conduct a group presentation about the shoulder part. Okay. The first presenter is Nur Najwa Izzati binti Ramli. The second one is Muhammad Amirul Luqman bin Rasdan. The third one is Zaidatul Aisyah binti Bakhtiar. The fourth is Muhammad Amirul Syafiq bin Syukur. And the last one is Muhammad Shahrizal Fitri bin Muhammad Fazli. Okay, for the strapping, tapping and kinesio taping procedure will be conducted by Zaidatul Aisyah, Muhammad Amirul Syafiq bin Syukur and Muhammad Shahrizal Fitri bin Muhammad Fazli. Okay, that's all. And the next presenter, which is Nur Najwa Izzati binti Ramli, will conduct a presentation about the anatomy of shoulder. Okay.
Hi, Assalamualaikum. My name is Nur Najwa Izzati binti Ramli. Today I want to talk about the anatomy of the shoulder. The shoulder is one of the largest and most complex joint in the body. The shoulder joint forms where the humerus, which is upper arm bones, fit into the scapula. The shoulder blade is just like a ball and the socket. There are four the important bones in the shoulder, which is first is acromion, is a bony projection of the scapula. The second is the clavicle, which is the collarbone meets the acromion in the acromyoclavicular joints. The third one is the coracoid process, is a hook-like bony projection from the scapula. And the last one is the shoulder has several other important structures. The important structures like rotator cuff, the bursa and the labrum. Rotator cuff is a collection of muscle and tendons that surround the shoulders, it giving support and allowing a wide range of motion. The bursa is a small sac of fluid that cushions and protects the tendons of the rotator cuff. A cuff of cartilage called the labrum form a cup for the ball-like head of the humerus to fit into it. The last shoulder muscles are responsible for most of the shoulder's work. Trapezius is responsible for elevating the shoulder blade and rotating during arm adduction. Deltoid is responsible for flexion and medial rotation of the arm. It's also responsible for arm adduction, extension and lateral rotation. Pectoralis major is responsible for arm adduction and medial rotation of the arm. It also involved with air intake and in-breathing. Rhomboid majors help keep the shoulder blade attached to the rib cage and allows you to pull your shoulder blade. The rotator cuff muscles. There are four muscles of your rotator cuff keep on the head of your upper arm bone, the humerus, from popping out the socket and the shoulder blade. First one is the supraspinatus, is responsible for beginning the upward motion of your arms after about 15 degrees. The deltoid and the trapezius muscles do their work. The technical terms for the motion is horizontal adduction. And the second, infraspinatus, mainly help the rotation of your arm away from the center of your body. It's the second most frequently injured shoulder muscle. Teres minors help with the lateral rotation of your arm. Subscapularis helps stabilize the shoulder joint and allows it to rotate so the arm can turn toward the main line of your body. Other muscles shoulder is pectoralis minor, protect your shoulder blade and allows you to the lower shoulder.
Okay, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Thank you for watching our group video presentation about the shoulders, and thank you for Dr. Ahmad Zukan and Ismail and our friends for watching this video. Okay, I'm going to conduct a presentation about the common injuries at shoulder. Okay, common injuries at shoulder is about whether throwing a ball, paddling a canoe, lifting boxes or pushing a lawn mower. We rely heavily on our shoulders to do a number of activities. Common injuries of shoulders such as rotator cuff tear, shoulder instability, frozen shoulder, overuse or strain and arthritis. To keep shoulders healthy and pain-free, it's important to know how to spot and avoid common injuries. Okay. The first one, common injuries at shoulder is shoulder instability. Shoulder instability happens most often in young people and athletes when muscles and ligaments that hold it together are stretched beyond their normal limits, caused by certain motion used in tackling or pitching, for example. This motion put great force on the shoulder. If this happens, the clavicle is pushed out of place and may form a bump at the top of the shoulder, as known as a dislocated shoulder. Treatment depends on the severity of the sprain. Sometimes surgery is needed. Okay, this is a figure about the dislocated shoulder. As you can see, there is bump here at the top of the shoulder. Okay. The next one is rotator cuff tear. Rotator cuff disease may be the result of either a substantial injury to the shoulder or to progressive degeneration or wear and tear of the tendon tissue. Repetitive overhead activity or heavy lifting over a prolonged period of time may irritate or damage the tendon. There are different types of tears, which is partial tear and full thickness tear. Partial tear is about an incomplete tear. It damages the tendon but does not completely sever it. Full thickness tear, also called as a complete tear, it separates all of the tendon from the bone. With a full thickness tear, there is basically a hole in the tendon. Treatment depends on the severity of the injury, such as application of rest, physical therapy, and by using non-steroidal anti-inflammatory drug, or called as NSAID, for relieve the pain. Sometimes it goes to surgery process. Okay, this is the figure about the surgery, about the rotator cuff tear. Okay, the next one is about frozen shoulder. Frozen shoulder happen when extreme stiffness in the shoulder. It affects about 2% of Americans, most often between 40 and 60 years of age. Frozen shoulder can affect people with diabetes, thyroid disease, heart disease, or Parkinson's disease. The main symptom is not being able to move their shoulder in any direction without pain. Treatment can be NSAID, cortisone shot, or physical therapy. Okay, the next one is overuse strain or strain. A sudden increase in activity can place great stress on the shoulders and lead to a loss of flexibility. This is a common problem in middle age, especially among people who don't exercise regularly. Although painful and inconvenient, overuse problem can often be treated with rest, NSAID, and stretching exercise. Okay, the next and the last one is about arthritis. Starting as early as age 50, some people get osteoarthritis, which cause painful movement. This happens as the smooth surface of the cartilage that line the bones of the shoulder joint are worn away, and joints start to wear out. Most common cause of osteoarthritis are overuse. The usual treatment are rest, NSAID, and cortisone shot. Okay, that's all from me about the common injuries at the shoulder. Thank you for watching our group presentation video. Okay, the presentation will be continued by the others. Okay, that's all from me. Thank you.
The do and don't of shoulder pain. What to do if shoulder pain? If your pain is sudden and has occurred after some specific incident, it is important to get it diagnosed by a doctor. Check with your doctor or therapy if a brace is required to stabilize the shoulder. It is important to keep attending the planned rehab season regularly without a break, as per the recommendation of the specialist. Okay, next. What do you do with shoulder pain? You must stop doing abrupt movement and jerky motion with the painful shoulder. Avoid carrying heavy load with the arm on the painful side. Sign the weight almost certainly aggravate the injury. Do not sleep on the painful shoulder at all. Do not take your rehab season lightly and perform them diligently as advised. That's all for me. Thank you.
So the equipment for this kinesio taping is you just need a kinesio tape and a scissor. What to do when you do a kinesio tape? You just need to cut around the corner. so it will make the kinesio tape to not get curved when you floating on and off. Next, make a little friction when you already put on the skin, so it will make the kinesio tape attach well on your skin. So next, clean your body before you put the kinesio tape. So what you should not do when you put kinesio tape on your skin, you should not put the kinesio tape on your skin when your body is already have oil or lotion that you may have on. So next, make sure that you do not touch the adhesive of the tape, because it will lead to the kinesio tape not attach well on your skin. Assalamualaikum. My name is Muhammad Sharizal Fitri bin Muhammad Fazli. So as for today, I will demonstrate about kinesio taping that I will do on acromyoclavicular injury that also known as AC joint injury. AC joint basically is a collarbone that meets clavicle. So the first step of this kinesio taping, you will need to lay down the patient up and make sure the patient body is in a good posture. Okay, so next we will stretch the skin in the shoulder and neck. So we will move the patient head on the left and looking down. So it will be stretched over here. So the first step, I will take one pieces of kinesio taping that I already cut around the corner, so it will not detach when you clothing on and off. So I will make a tear in the middle of the kinesio taping. So make sure to do not touch the adhesive of the tape, and then make a pressure using your thumb with a flat like this. So we will stretch around 80% of stretch and put that I already put a spot on in the AC joint. So 80% and 100%, 80%, and put it. And zero stretch at the end of the kinesio tape. Then I will take the next tape of the kinesio tape. Also same, we will make a tear in the middle of the tape. Make sure to do not touch the adhesive of the tape. Make a pressure. And 80% of the stretch, 100%, 80%, and put it on. Zero stretch on at the end of the kinesio tape. So the next part, I will take the third piece of the kinesio tape. Also same, tear in the middle. %, stretch, 80%, and put it on. Zero stretch at the end. Also same, zero stretch at the end. The friction on the tape. The last part, the last of kinesio tape. Also same, we made a tear at the middle of the tape. %, stretch, 80%, and put it on. Zero stretch at the end of the tape. Make a friction. Okay, that's look good. So in this video, I will demonstrate about kinesio taping on a rotator cuff injury. So, where to put the kinesio tape? You will need to find a bony prominence, and then a little bit down until you feel a soft spot in here. So, in this spot, I will put the kinesio tape. So, I will take the one piece of kinesio tape and make a tear at the end of the tape. Make sure to do not touch the adhesive of the tape. So, the soft spot, and put it with zero stretch. Make sure the patient body in a good posture. And then I will make a 25% of stretch on the back of the shoulder. 100%, 50, 25. You can put it on. Zero stretch at the end of the tape. Make some friction on the tape. And I will take the next piece and make a tear at the middle of the tape. And we'll make a stretch around 80% and put around at the back muscle of the shoulder, around here. 100%, 80%, and put it on. Zero stretch at the end of the tape. Make some friction. And the next tape, also same, tear in the middle of the tape. Make a pressure on it. 100%, same, 80%, and put it on. Zero stretch at the end of the tape. Make some friction on the tape, so it will attach well on the skin. You feel good? Yes, good. Alright.
Hello, my name is Muhammad Shafiq Bijuku from group RSR 2433E. Okay, now I want to show you the procedure of the tapping and supporting the shoulder for rotator cuff injury. Rotator cuff refers to the group of muscles and tendons around the shoulder joint. Now, start strap at the front to back of shoulder. Then, apply rigid strapping tape and cross joining the front to back section of the strap. Patient arm into internal rotation. Apply new rigid tape. Then, coming across the front of the shoulder, use tension across and into the bicep muscle. Wrapping around the bicep muscle with no tension and across to the back of the shoulder. Apply 2 or 3 of the procedure depends on size of the shoulder. Make sure you're smoothing or rubbing the bandage. Don't use your glue to provide maximum adhesion and support. Lock this adhesive bandage application in using wrapping tape across the top of the shoulder and also the bicep muscle. For further security and maximal support, apply another 2 applications at the front and back of the shoulder. This further support the technique. Finally, drop in the tapping procedure to activate the adhesive mask to provide maximum support and protection to this shoulder tapping technique. Okay, next, I will show you how to traditional shoulder instability tapping procedure. This injury, this strip of the tape are applied in an attempt to stabilize the glenohumeral joint. Before you start tapping, place a pillow under the arm to position the glenohumeral joint in inside adduction. First, begin with tape over the anterior aspect of proximal humerus and pull superiorly. You can make double tape for the first tape support. Next, place a second strip of tape over the middle aspect of the proximal humerus and anchor over the superior shoulder. Finally, the third strip of the tape begin over the posterior aspect of the proximal humerus and over the anterosuperior shoulder. Okay, that's all from me. Thank you.